Live from New York, it's Benefits with Friends. I'm your host, Lou Bernardi. It is Thursday afternoon here in New York, and this is like deja vu. Um, Full transparency, because that's what we're all about in this industry now, transparency. We had a technical glitch. We didn't go live. And Emma, who I'm bringing right into the show right now, we've been talking for the last 20 minutes. But so, yeah, this is not Hollywood. Emma, I'm sorry. This is what happens when you agree to go on Boo's show. So
Listen,
yeah,
I may have given all my best insights already. I don't know. I hope
unbelievable.
I can
I jotted
remember
down
them.
so many notes. I did. So yeah, we were 20 minutes into our conversation, and now we're live for everyone to hear. So those were our best kept secrets, though. We're not gonna anyway. So thank you guys for joining us. Hopefully, there's still people out there. I apologize for the technical glitch. Not my fault. I don't own LinkedIn. Although I'm thinking about it. I'm been watching the stock a little bit, so maybe I could afford one stock. So, oops. Dale Sagan said, "Oops." He was a past guest, and so Emma Fox. For those of you who are not familiar with Emma, I'm going to read her bio again. I'm perfect at it now. Emma is the COO, Chief Operating Officer, and partner at ePowered Benefits, a benefits consulting firm designed to deliver high-performance health plans while staying committed to industry-wide transparency, which we're going to definitely talk about in a bit. Emma also is a creator of virtual coffee breaks. I don't know, is that a Zoom or LinkedIn Live podcast
It's
show?
I'm old school. I don't know how to do the LinkedIn Live. I just
Okay.
do Zoom.
It's so when it works, it's so easy. Anyway, coffee breaks have been great for the industry. I'm sure you have a big following there, and then that kind of morphed into those virtual meetings into a huge party last year, U Powered Symposium, which where were we in? Were we in Phoenix?
Phoenix, yeah.
We were in Phoenix. It was wonderful, great blast. Probably the talk of the industry functions last year. It was like a big celebration, but also huge collaboration. Some of the best minds in healthcare and health insurance, um, employers, benefit decision makers were there, I'm sure. Um, and also, I think one of the more challenging and impressive things that Emma helped create was the Certified Health Value Advisor course, which is available to benefit consultants and I think also employers now, right? I mean,
Yeah.
you can take that. Super valuable. I actually did that while I was in Phoenix, I believe, and yeah, I was really impressed. I think it was what was it about a 3 hour, three
It was
hour
five. It's a
was it 5 hour?
5 hour certification, and there's still stuff that could still go into it.
Oh my!
But yeah, it's a long one.
It was such a blast. It only felt like 3 hours.
Good, good.
The parts where you did the speaking and the educating went by so fast. There was another person up there. I don't remember who he was. They dragged on. No, I'm just kidding. So yeah, no, it was a lot of fun. There's going to be another one in February where I will be in attendance. That one's in Miami. Look, who wants to go to Miami in February? That's terrible.
I
So
know.
I have my hotel, my flight, everything booked already. I think I'm already packed. Um, Reject that phone call. Yeah, now everybody's going to call because they think the show's almost over. My cell phone and my office phone are going at the same time. So anyway, Emma and I have known each other a little while. We've met a few times at different conferences. She has a pretty big following, I think, in the industry. You need to these days, right? We need to get a message, a better message out to employers, and we're trying to help employers with all of their benefits, but it really is so focused on the employer sponsored health plans that have spiraled out of control, both from a premium cost standpoint, but also from an out of pocket cost standpoint. I think that's the thing that really resonates the most with me and motivates me is that I know that the type of plans that managed care has evolved into from $2 copays back in the early 90s up to $17,000 out of pocket on many plans and even HSAs with really significant first dollar out of pocket cost. It can't stand, not with what what I've known, and I'm sure what you know about what's happening behind the scenes with healthcare and with health insurance. So I'm going to stop there for a second. I'm going to deja vu. I'm going to turn it over to Emma. Let her introduce herself a little bit more if there's anything I missed, and then we'll get to the conversation.
Well, thank you for having me on. I did already say this, but it's a relief to have something other than fourth quarter madness to do for an hour. So, yeah, I think, we all kind of feel the same way. The people who follow me and those that I follow, we're all kind of fighting the same fight. And many people know that I used to work at a carrier. I was at carriers, for much of my career. And there just came a point where it became too hard to get up in the morning and do what you needed to do, regardless of how important it was to do a good job. And so I just don't do it anymore. In fact, I just try to do the opposite most of the time. And my job has really morphed a lot more into creating camaraderie and education and connecting people, getting brothers and sisters to stop fighting with each other and realizing that we're not each other's enemies. We don't, we might be doing the same work. We might even have the same job title, but we're not fighting against each other. We're fighting something much bigger. And so that's kind of what I try to do with most of my career these days. And it's been incredibly rewarding.
Yeah, the collaboration is really something. Actually, Ryan Miller, who I know personal coach, business coach, he actually released a short clip earlier today from the taping that him and I did maybe a few months ago. And I mentioned on there, this is my 30th year in the business. 5 years ago, I changed the trajectory. And in the first 25 years of my career, I did not make one industry friend, right? I had people I was friendly with, but I didn't share information with them. I didn't share information with my general agent, comrades or other brokers, right? I mean, I worked with brokers. I helped them provide benefits, but I thought, okay, these are all my secrets. These are all my strategies. This is how I get the lowest renewal and the best rate. And 5 years ago, when I saw under the hood of the health insurance and the healthcare, the true prices versus what we're all paying, I got really upset. And I felt alone, and I had to make a decision. Am I going to go back to doing it the way I'm doing it, knowing that knowing the impact it was taking on the members, the employees, and the employers that I was serving? Or was I going to try to figure this out? And in the beginning, I was trying to figure a lot of things out myself. And a lot of it you covered in the course, the Certified Health Advisor course. And I started, because I was searching out information, I came across other advisors in Texas, in California, in the Carolinas, in Florida. And it's like, wow, we're on the same trajectory. We're just like, we're all in little rowboats in the middle of Atlantic Ocean, and none of us know where the shore is. And then we jumped on the same ship, and now it's become pretty powerful. I mean, still just scratching the surface. There's way too many employers and members to serve with the number of people that we are now. But the more shows like this and your coffee breaks get out there, it's going to pique the curiosity of employers and other benefit decision makers. And they are certainly going to start slowly looking for alternatives, because pay more, get less is not an answer,
Yeah. And, it's interesting because when we end up talking to some employer, the majority, I would say, of employers that we talk to have reached us at a past the breaking point. Like the breaking point was 2 years ago when they got their last crappy renewal, and then they've persevered a couple more years before they've gotten to the point where literally anything, even if it sounds like a gimmick or it's too good to be true or that could never possibly work here in this state, yada yada, they've gotten to a point where there is no other alternative. We've seen businesses in the last few years close their doors, and healthcare costs are a leading factor to people losing their livelihoods. And I I don't want to get too much on my soapbox, but that's really what we're talking about here. If people that are in the healthcare system are often facing life or death. And if it's not life or death medically, it's financial ruin in their personal life.
Yeah.
And on the employer side of things, people are closing down their businesses because they can't afford to provide mandatory healthcare coverage for their employees who are also going bankrupt.
Right.
It's like an evil empire. It really is. That's what it feels like.
That's what it is. It doesn't just feel that way. It really is. And there's so many people who have been groomed by the managed care fee for service delivery system, right? And I think about I go back to I was doing this. There was no managed care. There were no HMOs. There were no networks when I got in the business. We were selling indemnity plans. Companies like Chubb and Guardian and US Life and Home Life, those were the popular companies. And then these networks came out and people like, oh, well, what's that? And, the funny thing is when I think about change, and I'll see if maybe I'll play this video for us, the enemies of success, and, change is a big part of it. Back then, people thought that the 5-10% increases on indemnity plans were just out of control. And managed care plans came out with these books and networks and copays. No one knew what a copay was back then. But the consumer made a choice, just like they chose Netflix over Blockbuster. The consumer said, we like these plans. We love $5 and $2 copays. So we're willing to go through this disruption to educate our employees, because we don't like the $500 or $1,000 deductible and 80% coinsurance. Where's that going to go in a couple of years? So they jumped on board. They went through the pain of what that change was, basically because of people like me lugging 15 directories through New York City because nothing was online back then. So I was, my back was in pretty good shape back then, I guess. But change today seems so much more intimidating for some reason. The managed care plans, we're neck deep. We've been groomed to think that we're getting the best prices, that the insurance carriers that we partner with are negotiating great discounts with the healthcare system. And when you see the real prices, you understand that that's sadly not the case.
Right. It's the opposite of the case, right? I mean, we're seeing the hospital transparency data. Some who are complying are posting it. And if we can get it in some kind of readable format, we're realizing that networks are your absolute worst choice financially. But the problem is the members, the patients, they don't get to make that choice. They don't get to choose which carrier or which contracted rate. They don't get to shop to figure out, as they would with anything else, right? And so this has been a really interesting point in my career the last few months, talking to a bunch of people about how are we going to use that data? It's only good if you can do something with it. Well, we know now that networks make it worse. The cost is better when they're not involved, but they're this behemoth, right? Someone asked me on stage a few months ago, like, do I think the BUCAs are ever going to go away? No, they're never going to go away. They have more money than sense, or most of us have sense. But we can prove a point, which is that members have this like no choice at all in terms of what rate they're paying. They don't get an opportunity to actually be consumers. That's kind of why HSAs haven't really worked, right? Great in theory, but if they can't shop, how can they get a price? So I'm finding that there's a lot of opportunity in this data for us to recreate some of those payment methodologies where we can make reference-based pricing a little less painful if it's not just based on Medicare. So there's a lot, I think, in the next few years, we'll see a substantial change using that information.
Yeah, I agree with you 100%. One of the things that I'm noticing is that the healthcare system and the health insurance companies, behind the scenes, they're at war with each other. The providers are becoming the insurers. The insurers are buying the providers because they know through my sense, I'm not in the boardrooms with them, but my sense is that they understand the consumer is becoming I got to get to the
you,
question.
you have to.
Yeah, that caught me off guard. It was pretty funny. Now I saw the comment before that. So the consumer is becoming more informed, and the
Mhm.
carriers and the healthcare system are starting to change their lingo. They're starting to use terminology that really means something, but I don't think that there's really a profound um, desire that they really change their business practices. But perception is reality, and as long as they start using some transparent type dialogue, they're going to get the benefit of the doubt. But I think they
Mhm.
realize some of the current profit centers, the artificial prices, the hidden profits, they will dry up. And they both have a fiduciary responsibility to try to maximize their profits. So they can't just let it happen. So they're going to create new profit centers, and that's by jumping into each other's shoes.
Oh yeah, yeah. I mean, they're mammoths. Like there's not really any fighting them. You can go around them, you can do something different, but you really can't fight them. You know, it's like David and Goliath,
Yeah.
literally in our case with our David. But what you said in the beginning was really important, which is we have several entities in our industry, both on the care side and the insurance side, that are at war with each other. And if there's anything I can impart to any audience ever, it's that we're not each other's enemy. We're truly not. If you ever talk to a doctor, tell me one time you've ever talked to a doctor who said, "I love insurance companies. I love working for this big hospital who makes me focus on production instead of quality of care." It doesn't happen. It's not doctors that are the problem. It's not
No.
brokers who write fully insured business or take commission either. Those guys are not the problem necessarily either. I think what really needs to happen is that we all need to realize that we've been very effectively stuck in a system that's much bigger than us, that has determined what our value is through
Yeah.
our compensation, and we don't get any say in that. And it's BS. Like, where would this fly anywhere else, right?
No.
We really need to figure out that working together is going to be a lot more effective for us to make change than us fighting and pointing fingers at each other.
Well, yeah, I mean, and that's where the collaboration comes into play, because it just really it speeds it speeds our education up, right? The deliverers of the new alternative universe of healthcare and health insurance that are possible out there. So David, so David asked the question about the boo on my shirt, and I don't bring it up on every show, but since he asked, so and we talked about it before we went live. So the boo, my real nickname is Bubba, by the way. Since I'm an identical twin, and my brother and I have been calling each other Bubba for now 55 years. But a few years ago, during this whole path, um, I was I was working on my business card and said, I don't want to be a broker anymore. I don't want to be a consultant. I want to be an advisor. And I was reading an article in Benefit Advisor or HR Advisor magazine about benefit optimization. And here's the 10 or 15 steps that all companies have to do in order to optimize their benefits. And I read it and said, wow, that's amazing. They really hit some incredible points, but there's no way employers are going to be able to do that. They're not they're not able to devote the amount of time that you and I both know takes to raise their awareness. There's just so many rocks to uncover and look under, and that's what's so valuable about your course that you've created. So Boo is benefit optimization officer, like an outsourced CFO. I like to think of myself as an outsourced benefit optimizer, and a lot of the people that I advisors that I talk to, they see themselves that exact same way. It's really just a differentiator. So Dave, thank you for the question. And hey, Chris, thanks for sticking up for me there a little bit. I'm not going to play the video, but before we went live, I showed you the video about the enemies of success, right? And the enemies of success, the three main ones were the comfort zone, learned helplessness, and the path of least resistance. And when I think about renewal time, you know, most of the time we get our renewals for our clients 60 to 90 days prior, right? Because by law, that's when they have to be released. 90 days, I think, if you're large group, and 60 days for most small group business. It's not enough time. It's not enough time to do an analysis, educate a consumer, and the whole system knows this. Insurance carriers know we're going to release it when we release it, because we don't want the customer and the consultant or the benefit optimization officer to really have the time to do all the due diligence, to have all the conversations that need to be taken place and make change, right? So we're as in essence, we're change makers. And for me, that has to happen outside of the normal cycle, right? That has to happen like when you renew your plan and finished open enrollment. It's not a time to close the book and wait 9 months for the renewal to come out again. That's the time to learn. For me, the renewal is not the start of the new plan year. For me, the renewal is the end of the last plan year. And what did we learn from that renewal? And where can we make change for the better to have more success next year? And more success for me isn't really measured on, can we save money? It's, can we help the people that we're providing this valuable benefit to be healthier, lead healthier lives, get the care that they need, right? And that's really where a lot of the data comes from that is available, even on those small groups. I mean, you know as well as I do, there's a lot of technology, artificial intelligence companies where we can extract data for customers that are still doing it the fully insured old-fashioned way. I don't know. Have you had any experience, personally with them? You have any stories to tell if you did?
Yeah, I mean, I agree with everything you said. I think the change and the comfort kind of goes hand in hand. You sat through the CHVA course, right? And we gave
Mhm.
a really good example there about how consumers right now are finding their way to doctors. And it's Google. It's like looking up a Yelp review, except
Yeah,
the doctor is reviewed by other patients who've been there, 12 different times for an injury that hasn't been healed.
right.
And that's what we've given them. And even today, Lou, we will encounter members on our plans who we tell them, we look up their surgeon, because they're not having good results, and we look up the surgeon, we say to them, this surgeon is not good quality. And they're so comfortable. You can present them literally like on a piece of paper, this is bad for you, and they will still do it. It's almost akin to addiction at this point. Like,
Yeah.
you just can't put it down, you just can't look away. We have tons of databases, though. We have so many smart, incredible people in this industry that are creating tools all day long. But to your point, and the video that we watched that I hope you'll post somewhere else, most of the battle is just being comfortable enough to try something different and trust that the data, the science, the process is going to take care of you. And a lot of people don't have that level of bravery because, frankly, they've always done what they've always done, and
Yeah.
there's a lot of comfort in that.
It just starts with the conversation, right? And I
Mm-hmm.
always say, like, I just want to, through this show, through our website, through some other, venues, we just want to share that there's an alternative universe of solutions. It
Yeah.
can't hurt you to just hear about them. Imagine what the impact can be doing it this other way. And I fully expect most of the time people are going to go back to doing it the way they did it. And then in year 2, they're going to be like, "Ugh, again?" And then in year 3, and that's when we find that we get most of our new clients are after they've increased their awareness, and then they realize, wow, this really is hurting our company. Where are we going to be in 5 more years of this
Mm-hmm.
status quo? I mentioned it on a bunch of the shows, but it's worth mentioning again because it gives me goosebumps. My first experience with an independent third-party administrator, independent clinical case management company, and pharmacy benefit manager. I'm sitting in my office that I'm sitting in here. We had just changed from an insurance carrier, fully self-insured model. They were self-insured already, but with an insurance carrier. And maybe a week or two into the new plan year, we had just finished open enrollment. I got an email from the clinical case manager, which I'd never had before. This is my first one. And then, Lou, here's the scenario. This person is going to start this treatment, and we want to talk to them. Can you let the company, the HR manager, let this gentleman know? Well, first of all, they needed the name of the person because to them it was just an ID number. So they needed contact information and said, do you mind asking the HR manager or director to reach out to let them know that this is legit? This is a new part of their health insurance plan because they probably haven't experienced this before. And then just to speed it up, what ended up happening was a young man who was on disability with multiple sclerosis that was about to start an injectable medication that was $115,000. It was twice a year. So $230,000, that's just a number. I don't really, the number doesn't faze me. But it's a medical claim that's going to be administered in the doctor's office. It's not a pharmacy benefit. This person has a $3,000 deductible and a $7,500 out of pocket. The old way, he would have had the injection, and 3 weeks later, my worst nightmare is that it changes his life for the better. And then he gets the bill, and he gets the EOB confirming what the bill has already told him, you owe $7,500. And then he never gets it again. And that quality of life that he experienced for 2 or 3 weeks is forever in the past. Or the alternative is he does get it, and now he can never go on vacation with his family because it's going to be $7,500 every year for the rest of his life. And that, to me, the alternative, and what we did was we sourced it directly with a great company. They went to his home, they delivered it, and it cost that member $0, and it saved the employer $100,000. And I say that last because for me, that's the last thing. The savings is huge. That's probably why a company does it at the end of the day, right? It pushes them over the border, the finish line at least, to take this route. But I don't know if you have had any similar, individual stories, because it's about the people, really.
Yeah, I mean, we deal with it every day. So all of our health plans, I'm sure many people know, we don't use networks. We're all open access. We lean heavily on direct contracts, but we have to fall back on reference-based pricing. But the benefit there, as full of friction as those plans can be, is that we have an opportunity. There's like a stopping point, a pause, where we have an opportunity, like you had, to say, hold on, we can maybe fix this before something bad happens. And when we can, it's beautiful, but it can be anything from sourcing medication. And it doesn't have to be drastic. In your example, that's a beautiful example of something drastically improving someone's financial situation. But, for many people, they can't afford $1,000 or $500. And people are breaking their pills in half or not filling their prescriptions. I look at data for our clients, on a monthly, quarterly basis, and some of the better analytics platforms will tell me, are people adhering to their care plan? And most of the time the answer is no. And the biggest barrier isn't access to care, although sometimes that's an issue. It's the finances, it's the money. It's costing them an absolute fortune. And so we look to source medications. We look for bundled rates. Coral is, I don't know if anyone knows Coral, but their team created this incredible marketplace where you can just go shop for bundles that are guaranteed and save a ton of money. You can, to your point, you can source medication internationally, domestically. The problem, not the problem, but the barrier we always have is convincing people that this is legit, because it sounds too good to be true. Right. And they just don't believe that there's another way to do this because there's never been another way. And their broker surely has never told them that there's another way to do it, right? So there's tons of opportunity, but not a lot of access to those people.
One way that I try to make people comfortable is say, okay, this is everything that you have now, everything that your insurance carrier and your healthcare system is delivering to you now, plus the things that they should, but they won't, because they have a misaligned incentive, to do it the way they're doing it. And the reason why the education is so important is because until the customer starts demanding more and understanding that their expectations are way too low, I don't fault a broker for selling insurance. because that's what the customer oftentimes is asking for, right? So they're just selling what the consumer is asking for. If the consumer doesn't raise their awareness so that they could properly set expectations, they're not going to get delivered a better product. There's fear, right? This is hard sometimes because we're trying to convince people that aren't asking to be convinced. They just want
Right.
a better version of what they already have now. Most people, right?
Well, I agree with you though. Like I don't begrudge any broker for selling fully insured products. There is a place. There are restrictions. In fact, like there are some places where there is no other option but to be strategic and smart and intellectual about those products as best you can. But think about it now. I'm going to date myself, but it has been maybe a couple decades since I got licensed. Right? You remember getting your license? What did they teach you about? What did they teach you about? They taught you about fully insured products. Yeah. It was all I learned in order to become licensed to be someone who sells, benefits insurance. That's the only thing they taught me. And when I came out of that environment, I had to forget everything that I learned. I had to keep some of the stuff, but I really had to relearn a completely different way of purchasing and healthcare delivery. And so the average broker, I don't even think I know anyone who comes out of school nowadays and says, hey, I want to be an insurance broker. That looks fun. But they're getting licensed. That's their first step. And they're learning exactly what the carriers want us to learn because that's what they want us to sell. And I hope that we're creating more educational pathways so that people can expand their knowledge, of course. But we're just stuck. It's really no one's fault. It's not the broker's fault at all. And a lot of people the conference that I had, right? Everyone knows that ePart Benefits is fee-based. We don't do health plan commissions. And it broke my heart because we were coming to almost the launch date of the first symposium. And I got a call from a female broker and she says to me, listen, I've been looking and I want to come to your conference, but I don't think I'm allowed because I take commission. And I was like, oh my gosh, of course you're allowed. Like everybody is allowed. Like I was just devastated. And I really changed my message after that phone call earlier this year because I realized I wasn't being clear enough. I don't really care how you get paid. I just care about what value you're delivering for the paycheck that you're getting, right? And so I think a lot of us are just stuck in a system and many of us have already written a book of business. We can't very well just turn around and put it down and be like, oh, that's our family's income. Yep. We can't just start over. Many of us are not that privileged. So it's going to be small. But before we went live, you said you just have to do one little thing here, one little thing there. And that goes for employers and for brokers as well.
Well, I use this line a lot, but the conversation is very complex. The solutions are simple. The solutions are simple, right? You couldn't, well, maybe you could. I couldn't explain to you how my car starts. I couldn't explain to you the engineering and electricity and all of those things of what happens. You don't even put a key in anymore. When you push that button, what's happening under the hood? But we all know how to drive. You don't need to know how something drives or works to operate it. You don't need to understand every intricate part. That's your job and my job, right? Of vetting the companies, understanding. We're just trying to say, hey, let's go for a test drive. And by test drive, I don't mean let's try this for a year and see if it works. Let's do an analysis. Let us show you the numbers that we talk about. Let us capture those numbers. Share your renewal with us. Let us break it down and have a conversation that's not going to be focused on the net premium increase. Let's talk about what retention is, pooling charge is, credibility, all of these different factors. I compared 3 renewals recently, January 1 renewals, all fully insured, large group. Not one of them from the exact same carrier had the same trend, credibility factors, retention. When I started calculating the retention, it was shown as 17%, but they did something very clever with the math. They took 0.17 and subtracted it from 1, which gave them 0.83, and they divided the number by 0.83. which was equivalent to a 20.4% retention. So there's a lot of really creative things. When you break it down and you get into the nooks and crannies that kind of really make our life fun. I love being able to, sit down with an HR director and say, first of all, have you seen this page of the renewal first? Have you seen this financial breakdown? A lot of times it's no. Let's go through it. Do you have some alcohol? Maybe we should do some shots before. But it's become a lot of fun. And one of the encouraging things that I know we have to end soon about the U Powered Symposium last year, and there's another one in February. I think we talked about that before the second taping of the show. Definitely look up U Powered Symposium, February of next year in Miami. One of the real super encouraging things for me, and I've been in this for 30 years, I still think I'm one of the young guys in the industry, but there are people older than me. There were advisors that were in their 80s that I met there. I'm wondering, wow, how hard must this be? Right? How hard must this be with the technology and everything? And then there were advisors. There were people there that were looking to be advisors that weren't even advisors yet. 20-something-year-olds that were getting into industry reminded me of myself. And I said, wow, I just want to leave this industry in better hands than it is now, that it has been in the last 10 years. And people like you and your courses and all of that hard work and digging and vetting and taking the lumps,
It's not easy.
It's not easy.
But thank you for saying that. I think, the U Powered Symposium was truly, it was a very impetuous decision. It did come from the coffee breaks. I had a lot of people who used to say, I wish we could do this in person. And I'm kind of like, well, why don't we, And my husband's like, oh my gosh, just don't even. And I think I had it all booked within 2 weeks,
I'm
He's
sure.
like, oh my gosh. But
the
truth is that
maybe just a little compulsive.
I'm a little bit, but it felt so important to me. It really did. And unfortunately, I didn't get to experience the conference as everyone else did. I was kind of running around.
Yes.
But what I did get to see were a lot of the stuff that was happening in the hallways and the conversations that people were had. I saw 2 grown men cry at the U Powered Symposium in gratitude for the conversation that they had with each other. It kind of opened up this platform where you could be anything. You could be at any part of your journey, at the beginning, towards the end, kind of in the middle. You could be refiguring it out. And it just didn't matter. Everyone was there just to support, to lend a hand. And I firmly believe that there is way more that I don't know about this industry than I do. And I know there's someone out there like you or Chris Fisher or Mark Testa who can help me. Yeah. And I know that as smart as those folks are, there's some stuff I know that they don't. And so why wouldn't we? Why wouldn't we help each other be successful and help other people too? And yeah, it sounds, a little kumbaya-ish, but I believe in it, and it legitimately works. It truly does.
It's how movements get started, right? It has to start somewhere with a dream, and that's the thing that's just so amazing about it, is that there's so many people on the same path, and the pain that they're going in on a daily basis. So when someone reaches out and says, "Hey, who can we talk? You mentioned a company. I need to know who you're working with." I haven't had one person that I've reached out to that says, "No, that's my trade secret." And there hasn't been one person that's reached out to me that I haven't. I'll spend an hour with someone, And so this has been great. I know it ran a little longer than expected. We had a little glitch, but we got it done. And thank you so much. And enjoy next week, Thanksgiving week. It's my favorite week of the year. So enjoy. Hopefully you won't get the snow. I know it's happening upstate New York. They're getting a blizzard, maybe 3 to 6 feet, I heard. So that's my nephew's up in Binghamton, SUNY Binghamton. So
no, I'll keep my non-snowy, chilly weather, but I don't know. You don't seem like one for a whole lot of self-promotion. So for anyone who's watching, I think you should tell them that they need to go vote for you, since you are on the award ballot for the U Powered Symposium in February, and a lot of other cool people are too. But I'm really looking forward to the outcome, and I know you're planning to come. So I am very much looking forward to seeing you in February.
I don't think there's anything wrong with being in Miami in February.
No, not at all.
I'm sure that it will snow here at home because that's what typically happens, and I love that. But I might even bring my better half with me. We'll see.
You
We'll see.
should.
Yeah,
Spouses
we
are
have some friends.
welcome. So let me
Awesome.
know.
Thank you so much. Have a great
Thanks,
day.
Lou.
Enjoy Thanksgiving. I'll see you in February.
You as well.
Thanks.
Bye.
Bye-bye.